people who have been in contact with a person with monkeypox, testing them and getting the vaccine out to the most vulnerable populations. Currently, we have enough vaccine to cover about 5,000 people with their first shot. Dr. Huang will talk more about places where you can get the shot, how you qualify for the shot, give you our hotline number so that you'll know where to call between 9 and 5. And then you can always get information on dallascounty.org as well. I want to stress that this declaration is not a cause for panic. This is a declaration that we will use to try to open more doors to get vaccine faster, because we know that ultimately vaccination is going to be the key to getting the monkeypox outbreak under control. This is a disease that science knows a lot about. It's a disease that thankfully has not taken any lives here in the United States or Europe in this outbreak, but we want to contain it as quickly as we can. And we've got that opportunity now that we didn't have to any great extent earlier because more vaccine is coming out. And so I'm going to turn it over to Dr. Huang to tell you more. And then if you have any questions, we'll be glad to take your questions.
Sure. Thank you, Judge. As the judge mentioned, Dallas County has been seeing this significant increase in confirmed monkeypox cases over the last few weeks. I think today's official number is 215 confirmed cases. And so, anyone who's been in close contact with someone who has monkeypox is at risk. And if you believe you've been exposed to monkeypox and have developed any new rash on your body, then, please see a healthcare provider and be evaluated for testing for monkeypox. There are several sites and places where you can get that testing. I know Parkland, Prism, Methodist Hospital, Medical City, Baylor Scott and White, through some of their primary care clinics and urgent care sites may have testing available. They've asked, if you can contact them directly to inquire about the testing. Please avoid going to the emergency departments for testing only, unless other circumstances warrant the visit. But before seeking any testing, please call the providers first, as they may have specific directions or require appointments. And if you do go in for testing, please wear a mask, long pants, long shirt when you arrive for testing. As the judge mentioned, also, we are working with many partners to get vaccine out. The vaccine is currently being provided to people who are at high risk of monkeypox, which includes persons who had close, intimate, skin-to-skin contact with someone who's tested positive for monkeypox, or for men, including cis or trans men who are 18 and older who have sex with men. So men who have sex with men who have had multiple or anonymous sex partners in the prior 14 days. Want to emphasize, and we've all been saying, monkeypox is in no ways limited to any particular population, but what we've seen with some of the recent spread is because of some events, both locally and internationally. That's where there's been some of that close skin-to-skin contact that has been promoting transmission. The Dallas County, we are administering vaccinations by appointment only, and so we're also working with these other providers, some of them to help coordinate those appointments. So you can call the Dallas County Health and Human Services phone bank at 972-692-2780 if you are in one of those high-risk categories that we've talked about. And, as the judge mentioned, we received 5,000 doses, and that may sound like a lot, but it's not a lot given. So we're really having to prioritize and, get the vaccine into the arms of those that are at the highest risk of transmission to others, so we can try to slow down the spread. So really encourage people, if you're not at risk, please don't try to get the vaccine at this point. We're hoping to get more later time, but if you are certainly in any of those high risk groups, please, then you can contact us and getting on our waiting list. And we're trying to coordinate that distribution. And so we're continuing to add people to that wait list. We provided also, again, vaccine to PRISM and Parkland, and working with additional state and federal partners to expand the opportunities in the county. And we're hoping this emergency declaration, along with the federal declaration, helps us free up more resources. One other thing I just want to say, similar to COVID, there are things that we can do to prevent and slow down transmission in addition to vaccine. If you have monkeypox lesions and are tested positive, please isolate and stay home until your healthcare provider confirms that your lesions have fully healed. If you've had close contact or intimate skin-to-skin contact with someone who's tested positive for monkeypox, as I said, sign up for the vaccinations and also monitor yourself for development of any symptoms for 21 days, and go then talk to your healthcare provider for testing if you do develop any symptoms. And again, you can also avoid any high-risk situations and exposures where you might be around people who have lesions with close skin-to-skin contact. So if you can just avoid situations where there might be that high-risk exposure, that's another way for us all to work together to slow down the spread. So these are some things that we can do. And again, we're hopeful that the emergency declaration, along with the federal declaration, helps open up some more resources. Thank you.
Let me add one thing. There are some festivals coming up. If you are a man who has sex with men and you're going to a festival, we want to encourage you not to do that. Those festivals are not here in Dallas County, but there are festivals in the region. There's a big one in Chicago, and I'm told by Councilman Omar Narvaez that there are a lot of people planning to go to that festival. Places where there's a lot of skin-to-skin contact in the men having sex with men community right now. We're seeing that outbreak here in Dallas, and that outbreak is also in Chicago where that festival is. So I want to encourage people not to go to those festivals, to go out, see your friends, have fun, dance, whatever, but avoid skin-to-skin contact. That's very important. Keeping the shirt on and limiting skin-to-skin contact to people that and that you believe are monkeypox free is really going to be important. We're going to beat this through vaccination, but we can't beat it through vaccination if these numbers get out of control before the federal emergency declaration can speed getting those frozen bags of vaccine into those vials and getting them to us. So with that, we'll take any questions y'all may have, if you have any. If there are, oh wait, never mind. I see how this
Looks
works.
like Bianca Castro has her hand up.
Okay, thank you. Good morning. Out of the confirmed cases, can you tell me whether there are any hospitalizations and how many? And then any children or other people who are not in the men who have sex with men population confirmed with monkeypox right now in our area?
Phil, you want to take it?
I will say that I know there have been some hospitalizations. I don't have that exact number right now for you. We can try to follow up. The hospitalizations have been for those with more severe lesions and more severe, sort of production of the rash and things like that. It is painful, but we can try to get you more. But it hasn't been the majority. Most of the people have not required hospitalization. Again, it's been some, but certainly not most. And then what's the second part of the question?
Any children or any other people who are not in the men who have sex with men population that have confirmed monkeypox?
Yeah, I think we reported at least a few females. But I think it's like 98% of the cases that we've had are men. and almost most all are men who have sex with men. And at this point, I don't think we've had anyone under 18.
And that's a good thing because monkeypox tends to be worse for small children. So we're thankful for that. And we just got to get more vaccine from our federal and state partners. That's how we'll, end this thing, is we'll get people that will vaccinate a larger circle than the people who have it. And it will expand eligibility to more people who are in the zone of a heightened risk that we don't have enough vaccine to expand to at this point. Someone's asking, Sandy Manchada is asking, how long is the waiting list? Do you know, Dr. Huang?
It keeps growing. I know, again, I think yesterday it was like 800 or so. But then I know Prism opened up their phone bank for a period a couple days ago, and immediately theirs filled up. So there's a lot of demand, and that's what we're trying to work our way down the waiting lists and get everyone vaccinated. But again, we're working with several community partners, and we appreciate all of their collaboration. Some of it is, still getting ramped up, and so we hope, again, to get more vaccine and more distribution every day. But I think that's what the number was a couple days ago, or yesterday.
Bianca is asking, who are the community partners? So you mentioned Prism. You want to go through the others?
Yeah, Prism, I know we've distributed vaccine. Parkland, we're working with the Abounding Prosperity, AIDS Healthcare Foundation, Community Health Empowerment, let's see, Kind Clinic. I think we've been in conversations with the Resource Center, and but they're probably not going to be a vaccination site. And so, again, having a lot of partners that are working together with us on this.
Any other questions? Oh, I saw something about, will festivals be canceled? Well, the city of Dallas can look at what they want to do in the city of Dallas, of course. At this point, there's no plans to cancel anything. We don't have anything that we're aware of that's coming up. So, we're trusting that businesses that are open every day, like clubs where people dance, will be responsible. And, you can still go dance. Just make sure to have your shirt on and limit that skin-to-skin contact with strangers. Any other questions? Well, thank you. Oh, wait. Okay, that's not a question. So okay, one more question. Some areas are testing wastewater for monkeypox. Is Dallas County?
Yes, and we are part of the CDC surveillance system and working with the City of Dallas Wastewater. As previously had been set up for COVID, we are providing some specimens, and I believe there has been detection of monkeypox, which is confirmation, and we know that there is monkeypox certainly in our community.
Any last questions? Thank y'all all so much for being on this, for helping get the word out that this is a growing problem. It's not a cause for panic, but it is a cause for concern. And we are going to do everything that we can to get as much vaccine as quickly as we can. And then we have the network to get that into the arms of the people that are most at harm or most at risk of harm. And so we'll continue to work on this, long hours and make sure that we're focused on this just as we're focused on COVID and other health conditions. and we will get this under control, and we're going to beat monkeypox here in Dallas County. Thank y'all all so much.
Thank you.
Thanks.